When you have a patient walking into your clinic and you're diagnosing this particular patient as suffering from a particular kind of a cluster disorder, or which is also known as the personality disorder, we've already discussed the particular characteristic traits of these particular kind of personality disorders that we're talking about, that is belonging to this cluster A group. They are basically having those odd and eccentric feelings, and then people who are belonging to the cluster B group, they are more of the aggressive and the emotional type, and people who are belonging to the cluster C group, they have the extreme worry and fearfulness that is leading basically into their antisocial behavior. That is, they are suffering from this particular kind of obsessive compulsive disorders or these borderline personalities. So these are the different clusters that we've already talked about. Now, one should know as a psychiatrist how you're going to help these people come out of these difficult situations that they're suffering from. It can be any particular disorder that we're talking about. Then we are basically going to design that particular treatment for that particular ailment that primarily he or she is suffering from. So once you have taken the history in detail, you have assessed the patient and you have categorized the patient into the particular clusters that we're talking about, then we are going to go about and choose the different treatment modalities of these individuals as well over here. So in this section, we are going to focus on the initial assessment of these individuals, and then we are going to move on to the cultural considerations that are going to be quite helpful while we are dealing with these patients. So before labeling anyone, specifically the minorities with suffering from the paranoid delusions, one has to be quite critical. It can be a normal behavior of that particular minority that you're dealing with, and you're not basically more obvious about that personality disorder that we're talking about over here. So the treatment modalities will be also discussed over here in this section, along with the other points of considerations over here. So what is the primary impact on the life of the individual who is suffering from the personality disorder? They may develop the psychiatric problems along with the passage of time. So if it is a child in his adolescent, he may become psychotic. So if it is an adolescent in his adulthood, he may appear to be developing some sort of a psychotic disorder, some sort of a psychiatric ailment, may become less functional with time. So if it is a problem or the severity is less right now, with the passage of the time, if the treatment is not given to these individuals, the severities can increase from moderate to severe intensities as well. So then we have the EUPD, that is the emotionally unstable personality disorders, and then we have the problems may be exacerbated with time. So the highlight over here is that we have to treat these patients. Once the diagnosis is made, you have to go on and about and treat these patients. The mechanism of projection is very predominant by the cluster A personalities. They basically project their own feelings and their own thoughts on others. So this is the mechanism of projection that is quite commonly seen. Then how do you go about and assess these individuals? First of all, a detailed and thorough history is taken. The level of detail needed to substantiate a pattern of persistence. The pervasive personality trait is not obtained when the clinical focus is on the axis 1 mental disorders over here. So the psychometric tools that we usually use in our clinics are the MMPI-2, then we have the Million Clinical Multi-Axial Entries, and then we have the College Access to Inventory. So these are the multiple questionnaires that are usually divided. The question statements are given, then we have the different items, and then we have the ratings on the scales as well. So the psychometric scales are very evident over here, and one should know what are the assessment tools that we are using, and according to them, the scaling or the grading of the illness is done whether the particular person is suffering from a mild, moderate, or a severe form of a disease. The cultural considerations also have to be kept in mind. They should always be sought the extreme precautions while diagnosing the minority with paranoid personality disorders, and men are more likely to be suffering from the antisocial personality disorders. While when we talk about the women, they are more likely to be suffering from the paranoid, histrionic, or even the borderline personality disorders. So the treatments that are usually devised for the individuals are the countertransference has to be treated first of all, and then the psychological therapies are devised. The therapeutic community treatment programs are quite helpful, where you have a group of people suffering from the same cluster of personality disorder, and then you treat them accordingly in a group. So this group treatment is sometimes quite beneficial for people who are belonging to these personality disorders. Then we have the serotonin reuptake inhibitors, that is the SSRIs, the second generation antipsychotics are sometimes devised, and then we have the mood stabilizers that are also given for these individuals. When we talk about the helpful features of the individuals who are suffering from these particular kind of personality disorders, and when we are treating these patients who are suffering from these particular kind of personality disorders, the helpful features can be the early interventions. So as early the patient is intervened and the treatment is started, he is going to have a better outcome in that case. And then the specialist services are also given for these individuals as well. Choice from the range of the treatment, they are individually tailored. So it should not be that people belonging from various groups are treated collectively. It should be an individual care, and it should be an individual treatment that is given to these individuals. And then we have the therapeutic optimism and the high expectations. They develop the patient skill. So giving an insight to the patient is sometimes very important. If it can be done, a better outcome is there when the patient has an insight towards his illness, fosters the use of creativity, and they respect the strengths and the weaknesses along with them. A good, clear communication is very important. When you are basically counseling the patient, it should be in a clear voice, it should be in a clear language as well. So accepting the reliable consistencies, and then we have the clear and negotiated treatment. So you have to discuss the treatment with the patient and with the primary caregivers before starting off with the treatment guidelines over here. Good assessment and the treatment links are again very important. And then we have the conductive environment. So even the environment in which the counseling sessions are carried out, it's again very important that it should be more conductive and it should be more helpful. They listen to the feedback, and supportive peer networks are done. The shared understanding of boundaries is carried out. The appropriate follow is carried out. Attitude, acceptance, and sympathy is the highlight over here as well. And the atmosphere of truth and trust has to be developed when we talk about these disorders of the personality traits, and when we're helping these people who are suffering from these particular kind of personality disorders. So in this section, basically and mainly, we discuss the treatment guidelines and what should be the key features while you're treating a person who is suffering from a particular kind of a personality disorder. So that is the end of the section. Thank you for watching sqadia.com.